Again, sorry. So Christoph, if you could tell me a little bit more about the way that Engel works with its customers in terms of regulation in particular.
Right, it's a good question, Sam. Because today we see some customers who ask for interpretation of the GMP, for example, word by word, and this would end up in 20 pounds of documentation just for a simple injection molding machine.
Right.
Others do not care enough about documentation, and we at Engel think it's very important to use the common sense of people together with the real in-depth understanding of an injection molding machine, because in the end it's still an injection molding process, but for use for medical devices.
Right.
Now we try to understand the market. There are a number of fields for medical devices. On one hand side, syringes on the simple side, and implants, human implants on the very demanding side. And we try to, together with partners, develop a documentation, a GMP documentation, what is fit for purpose, and we try to interpret the GMP again with a good common sense, and try to focus on what is the machine really doing, and this certainly we covered with risk analysis and with the documentation process, and this ended up in a documentation what can be handled. It's
Right.
not a 20 books documentation. It's a one book documentation.
Okay.
What is affordable, what can be realized in a acceptable time. It does not consume months and months of putting the documents and the papers together. It can be supplied with the machine at the same time when the machine gets delivered to the customer, to the processor, and there are a good number of machines already in the market with this kind of documentation, this one book documentation, and this passed all the audits of at customer sites that were successfully passed, and so this was actually the confirmation that what we developed is just tailor-made and fit for the purpose, and not we did overdo this,
Right.
as it's sometimes done in pharmaceutical business.
Okay. Thank you very much.
Thank you, Sam.